How to use nipple shields.
Hi, my name's Louise Thompson. I'm infant feeding coordinator and lactation consultant here at City Hospital, which is part of the Black Country local maternity and neonatal system.
Thin silicone nipple shield. You can see it is nice and flexible. This one here has a cutout section at the top. Some shields have silicone all the way around, and there are some that have a cutout at the bottom as well. The ones that have silicone all the way around may stick on a little bit better, but the advantage of having a cutout section is that you have a little bit more skin contact with baby. Nipple shields come in different sizes. This is a large nipple shield, and this one here is classed as a medium. You can get smaller ones as well. This shield is a cone or tulip shape, but you can get ones that are a little bit wider or longer. The size of the shield depends on the size of the base of your nipple. You want it to be a close fit with about a 1 to 2 millimeter gap all around between the base of the nipple and the inside edge of the shield. So this shield is too wide for this nipple. This shield is still a bit wide, but it is closer to the nipple than the other one, so it is a better fit. Choose the smallest shield that fits you comfortably. The nipple does not need to reach the end of the shield, and there will be some space at the end where milk might collect. If your baby is small or a low birth weight, a large shield may be too big for them, so you might need to wait for them to grow while protecting your milk supply by continuing to express and using alternative feeding methods. Fitting the shield. Sometimes people will fit a shield by just placing it over the nipple, and baby comes along and knocks it straight off. What you need to do is invert the shield about halfway like this and stretch it across a little bit, and then place it over the nipple and then peel it back. And it's difficult with this model breast here, but on a real breast the nipple would be drawn further into the shield and would make it a nice snug fit. You can use a bit of breast milk or nipple cream to help stick the shield to the breast, although often that isn't needed if it is fitted on well. These nipple shields have got a cutout at the top here, and the idea of that is where the baby's nose goes. So the baby comes in like this, coming in nose to nipple, with the chin touching the breast first. So with the cutout, the baby can smell the milk a little bit better, which might help with rooting, and they are snuggling up against the skin, not the plastic of the shield. But if the baby is latched on well, with the chin pressing in, then the nose will be free from the breast anyway. You can also use the shield the other way round, so that the cutout is where the baby's mouth, chin and bottom lip will be. So there is a bit more skin contact and stimulation then, with the chin going in first and the baby going onto the breast. So try and see what works best for you. So when the baby is on the breast and the nipple shield is in place, you want to see all those same signs that baby is attached well. All of the cone part of the shield should be in baby's mouth. The chin should be pressing into the breast with the bottom lip curled back, although you should not be able to see the bottom lip. The cheeks should be full and rounded and baby held close, head free to tip back. And remember, breastfeeding should be comfortable. If it isn't, please get some support. Cleaning your nipple shield. Look after your shields. Wash them in hot soapy water after use to remove any milk residue. Rinse them under a cold running tap to remove soapy water, then dry with a paper towel or a clean tea towel and store in a clean dry pot with a lid. Sterilise the shield at least once a day. Make sure baby is getting enough breast milk. Look for signs of effective feeding like sucking and swallowing milk, and wet and dirty nappies that are appropriate for their day of life. Lots of babies will thrive on nipple shields as long as they are latched on well.
Using a nipple shield, cup or bottle is not the same as breastfeeding directly, and this can be a bit confusing for babies. But every breastfeeding journey looks different, so do what you need to do to meet your goals and get help and support as soon as you can. Remember, breastfeeding with a nipple shield is still breastfeeding. If you think using a nipple shield is going to help keep you going because breastfeeding is feeling very hard, then they might be worth a try while you wait and access help. You're doing a great job, and we're here to support you whatever you do.